Ladies and gentlemen, we have the Hospital Authority budget presentation. We have the Executive Director, Mr. Jason Boyd. Mr. Boyd, would you please introduce your guest this evening?
Thank you, Mr. Chairman. There we go. To my right, I have Mr. Waverly Crenshaw. He's the Chairman of our Board of Trustees. To my left, Mr. Bob Lonas. He's our Chief Financial Officer for the Hospital Authority.
All right, thank you. And I should ask you, Mr. Boyd, are you satisfied with the budget for the Hospital Authority as it has been presented by the mayor?
Yes, sir, we are.
All right, excellent. You may begin your budget presentation.
Thank you. Have a great evening.
Mr. Chairman, my name is Waverly Crenshaw, and
Yep.
I'm sorry.
Right there.
Mr. Chairman, my name is Waverly Crenshaw, and I serve as chair of our hospital authority. I want to apologize first to everyone present. I have an 8 o'clock flight, so if I leave before we're done, I'll be glad to come back and spend whatever time you want, all night even. But first of all, I want to start by thanking each member of the council for the interest you've had in General and Bordeaux and Nose Home. We've had some constructive and continuing dialogue that I think is moving. In fact, I know is moving us forward in serving the safety net community. A couple of entities and people deserve special thanks. First of all, the mayor's office, his staff, Mr. Riebling and others have been incredibly helpful in understanding our continuing budget issues and helping us meet that and meet the needs of the people of Nashville, and they should be thanked for doing that. Second, we are fortunate to have an incredible partner with Meharry Medical College. I want to recognize Dean Mouton, who's in the back. Dean, would you wave? The Dean has been instrumental in creating good dialogue between our CEO, Mr. Boyd, and his management staff as we continue to look at ways that we can improve the level of services to those who need it most. I know that Jason is going to go through a detailed listing of accomplishments that we've had. We continue to have struggles, but we have made some significant accomplishments in terms of serving the safety net community, and we've done so with a goal of being good stewards of the money that we have. Unlike the water department and others, we do not have a revenue source. What we have comes from you all, and we're uniquely serving those who do not have. So we continue to need the support of the council to do that, and with that, I know the board works at every meeting to try to make sure we're doing it in an efficient way. Again, I apologize for having to step out. I'll be glad to answer any questions, but Mr. Boyd and his staff are ready to do so as well, and I'll be glad to visit at any time.
Thank you. Mr. Boyd, if you'd like to go ahead with your presentation.
Sure. Thank you, Waverly. I think each of you have the packet in front of you, I believe, that got passed out. And feel free to stop me at any time as we go through this. Just want to take a few minutes, go through some key things in our presentation. Starting on slide 2, just again, and I know many of you know the history and the significance of Nashville General Hospital in this community. We are one of the safety net hospitals in this state and here in Middle Tennessee, licensed for 150 beds. Currently, we have about 550 full-time employees. As part of our work that we do in the safety net, we do about 40,000 primary care and specialty clinic visits annually. And those clinics are operated through our partnership with Meharry as their physicians staff the majority of those. We also provide about 36,000 emergency room visits to our community annually and deliver approximately 600 to 700 babies per year. As I said, we are the primary teaching hospital for Meharry Medical College. Around 170 residents and students at any given time rotating through the facility in various specialties such as internal medicine, OBGYN, family, community medicine, and psychiatry. We also are a training site locally for various schools throughout the community. We train anesthesia students, physical therapists, respiratory therapists, nursing, EMT students, just really all across the board for different schools in this community. And we also operate our own radiologic technology program where we train radiology technicians, which is the only hospital-based program in Middle Tennessee, which we're very proud of as well. Across town on our long-term care campus, we have Bordeaux Long-Term Care. This is a large long-term care facility licensed for 419 beds. Currently, we have around 250, I think today it might have been about 242 residents that reside there at Bordeaux, and around 300 full-time employees. Wide array of services, very talented group of folks work out there and provide exceptional services to the residents that live there. We have 2 partnerships out at Bordeaux with Kindred, who leases space from us and operates a long-term acute care hospital, and also with the Respiratory Center of Middle Tennessee, which is a chronic vent unit that they operate at our campus as well. Knowles Home, right next door to Bordeaux, we operate an assisted living facility and adult daycare. It's a 100-bed facility, stays pretty full, around 98 residents live there at that facility. They have about 50 employees. Our adult daycare program, roughly 40 residents rotate through there and utilize that service. Again, primary care services on site for those residents that reside there, hospice care as well, and we provide other social activities and services and transportation as well. So that's a breakdown of the facilities. Slide 5, really nothing there. I know we were just asked to show the subsidy breakdown over the years and what it looks like as we approach fiscal year 2014. Just a few notes. When you look at FY14, there is a footnote there to the side just to be aware of. That included it says 7.5, it was around $7.3 million debt repayment. It was an obligation that we had to this body, this city, from a loan from years ago regarding an IT project that we implemented. So out of that subsidy from FY13, we were able to satisfy that obligation with Metro, which we're happy to do. As you can see, moving into FY14, the new subsidy number there, which represents about a $4.5 million change in that subsidy. On slide 6, just wanted to kind of give you an idea of the population, the patients that we serve, and these pie charts here are specific to Nashville General Hospital. You can see that it's fairly consistent over the last several years, with about 15% Medicare, a large portion of our patients fulfilling that TennCare bucket, and then you can see the breakdown as you go around the chart. Obviously, the purple color and the blue color is our self-pay and charity care, which is about 40% of our payer mix. Obviously, that is a big number, and that's the intent of our mission and the mission of our partners at Meharry. And that's why we exist, making sure that population has access to quality health care in our community. Next slide, again, is really about meeting the mission. It's a pretty staggering chart to look at on page 7. As you can see, from 2011 to where we're projecting in our budget for this next year, pretty dramatic increase. This year, we project to end up at about $93 million in uncompensated care, and projecting in our budget as we approach next year a little over $98 million. So we've seen that number continuously rise in our community, and I think other communities around the state have seen that as well. So it really is a community issue, and we feel like we're doing our part to make sure that we're making sure these folks have access to care. Obviously, as the Affordable Care Act evolves and comes about, there will be some impact on that. A lot of that is unknown at this point. We have looked at potential conversions if our indigent patients potentially converted to Medicaid if a Medicaid expansion of some sort took place. So, I mean, there are some moving numbers there, but it's also important to note that if that happens, there's also some, funding that the state does now, whether it's through disproportionate share or otherwise, that is expected to go down as well to offset with these folks having access to insurance coverage. So it's really a moving target, but it's absolutely important and critical to us as we go forward. On page 8, we started putting this in here. I think it behooves you all just really to see where the breakdown of our patients are coming from, respective to your areas that you serve. So we did want to break this out by where our inpatient, outpatient, and newborn patients are coming from. We thought that would be helpful for you all. As you can see, we're pretty localized in 37208 and 37207 from an inpatient and outpatient perspective, really is our core service area, and that's in our North Nashville neighborhood. You can see the next two, 211 and 013, significant amount of newborns come from that area. If my memory serves me, that's Nolensville Road, Antioch area. So you can really see where our patients are accessing us from and where the critical need exists for those patients. And if you have any other questions specific on this, I'd be glad to get those to you as well. On page 9, we just really wanted to kind of highlight some of the work that our staff has done, because it really is about the people that are at work right now, making it happen, taking care of patients. We've done a lot of work and made a lot of progress, made a lot of tough decisions, done a lot of uncomfortable things to make sure that we could still be sitting here today talking about the great things we're doing and the patients we're taking care of. Our direct expenses for FY13 are projected to be down about $13.5 million over FY12. That's a big number, a lot of work, a lot of retooling, maximizing our efficiencies. Second there, I think, is an important step that we've made, and I still think presents some significant opportunities to expand in the future. We redesigned our IOD program to our own internal work-related injury program, and we've seen significant savings with that program, approximately $700,000 a year over our prior program. And we look forward to continuing to expand that, and hopefully that will afford us some other opportunities, hopefully across the metro government in the future as we refine that and make sure that our employees and potentially others can have access to great care and get them back to work in a timely manner. Another program that this body helped us enact was our Metro Healthcare Incentive Program. We continue to see that. It rose very steadily, and then I think we've kind of hit our level mark of where we are, around 3,500 patient visits annually, which that's a gross number of about $4.6 million, which nets us about $1.7 million a year. So that's significant volume. Most of those had never accessed our facility before. And we were thankful to we added NES to this program just at the end of December. So we're starting to see some of that volume hit and hope that we can continue to grow that program. Obviously, doing clinical work that we do, we work with our partners to recruit key physicians. You can see some of the specialists and physicians that we've recruited there to continue to provide access to our patients in the community. We've done some technological advances around our radiology PAC systems, voice recognition systems. All these things are really an effort, one, to keep up technologically, and two, help improve efficiency and community standard of care as we continue to provide patient care. We've done some equipment upgrades from our mammography unit to our CT, computerizing our electronic medical record in terms of physician order entry. And there's still a lot to be done. It takes a lot of capital dollars to keep a hospital moving forward. So that's something that we're still very strategically working on to be able to continue to do that. Our staff has done a great job, and we've completed successful Joint Commission surveys at the hospital and state surveys at Bordeaux in this past fiscal year. These are accrediting bodies which keep our doors open and make sure we're providing high-quality care. And our folks have done a great job, and we have been very successful at those surveys. Out at Bordeaux, we're working with our partners on our vent unit. That continues to expand and is a good niche and business partner for us as we move forward. And, one of the things we're proud of in a program that's going on right now is our Mammograms in May program. We're in our 10th year of that, and it's going on right now. And we've served close to 5,000 women, making sure they have access to mammograms that wouldn't have got them otherwise. I mean, these are women that may come from the homeless shelter or not have access to health care. And over those 10 years, we've diagnosed 22 cases of breast cancer that were undiagnosed before they came to see us. So that in itself, to me, is an exceptional number and really a success story for our facility. Obviously, as we go forward, it's a challenging road ahead. We have to continue to create sustainable funding from various sources. We have to continue to address our capital needs. We have to continue to make sure that we are as efficient and running as efficient and lean as we possibly can. And, we benchmark ourselves against peer facilities, against facilities that are not government as well. And we feel like we've made significant progress in doing that. We're in the process of looking at redesigning a lot of our clinics from an access standpoint to meet what the community is telling us they need. And that is truly important, and we've had some great help from some of you all in doing that. And, looking at how our emergency department funnels volume in, those volumes continue to rise. Obviously, significant amount of those could be taken care of in other more cost-appropriate settings. We just have to set those settings up to be able to make sure those patients get care. And really just continuously looking at and addressing the growing needs of our community and make sure that we set up and maintain a sustainable business model so that we can be here going forward, and I can sit in front of you next year and the next year and talk about the great things that we're doing. So with that, I'm proud of our team, the support of our board, the support of this body. A lot of folks have done great work, but there's still much work to do. We've tackled some challenging, unpopular issues, but I think they've been necessary, and I think we all realize that we have to continue to evolve as a healthcare delivery model in order to be successful and to be here in the future.
Thank you. Chairman Matthews.
Thank you, Mr. Chair. Thank you, Mr. Boyd, for being here and company. I want to thank you all for the work that you do at the Hospital Authority. I mean, General Hospital and Bordeaux Long-Term Care and those facilities are very important facilities to our city. Of course, two of those facilities do sit in my district, and I know this isn't part of your current budget or what you're here to talk about, but there's a deal book out for Bordeaux Long-Term Care and those facilities. Could you speak a little bit about that? Because as recently as yesterday, matter of fact, I received an email and had to explain to constituents what is actually going on with that deal book. So could you explain for the public a little bit about that process, please?
Okay. So a few months ago, we engaged in a process, obviously in collaboration with the city, to look at the potential other opportunities for Bordeaux and Knowles. And that could be other operators, owner-operators, and started down that path. What we did to address your comment around the employee that sent you the information, it's challenging for employees. It's a tough thing to swallow when you've worked somewhere for 20, 30 years and you get the message. And I know because I stood in front of them and delivered the message, so they didn't see it in the newspaper, so they didn't hear it from anybody else but me, and talk to them about this process. And I think the uncertainty is there, and we knew it would be there. Our obligation, and I think I speak for the board when I say this, is to make sure that we take care of these employees as we get into any potential transaction that may take place. Obviously, our first and foremost, we have to make sure that the residents that are taken care of and that care transition takes place. But we continue to communicate with the employees. There's a lot of unknowns, and as that progresses, we have to be very open and honest with them about what that means and make sure that we try to guide them through that process to make sure they're taken care of.
Thank you, Mr. Chair. I think this is very important. Do you have any proposals in front of you right now?
No, we
that
don't
you're
have.
considering?
No, sir.
Okay, and what's the deadline on proposals being sent?
I think toward the end of this month is the deadline for the proposals to be submitted.
So I think it's very important, and can you confirm that until that deadline passes, you won't even be considering those proposals, and no decision has been made either way on the future of those facilities at this point?
Absolutely.
All right, thank you.
Thank you, Mr. Chairman. Councilmember Moore.
Thank you, Chair, and Mr. Boyd. It's always a pleasure to see you.
You as well.
I just have about 3 questions. On page 3, you had mentioned, you had listed, what is Eden Alternative Home? I've never heard of that, of your handout on page 3.
Sure. The Eden model is really a specific care model that a lot of long-term care facilities use. It really addresses how you care for patients in the environment that you let the patients in, where there's pet therapies, all those different nuances that really make the environment more like a home for the residents. That started several years ago, even before I came to the facility, and it's really around building a culture of home, not you're here in an institution, but you're here at a home.
Okay. And then on page 8, is this, I'm always interested in zip codes because where services are where constituents have went to you all for services. And I looked at some of the numbers here for my district and was just wondering, is this the 2012 numbers or 2011? And has there been an increase in of constituent base using the services at Metro General?
First, I think the utilization from the zip codes has been pretty consistent over the years. I think we've seen that as very consistent because I know we looked at this last year. And this data here is calendar year 2012.
Okay. And do you all have anything from 2011? I would just like to see, has there been an increase or, stabilized? Like you said, there could be the same numbers, but sometimes we like to look and compare and contrast sometimes. So.
Okay. Sure, I can pull 2011 data.
Okay. And then page 9, you talked about where the Metro Employee Healthcare Incentive Program, and then you said NES has joined that as well. Has anyone else on the line to join the providing services as well? Anybody?
Not right now. Not on the cusp of joining. Obviously, there's some very stringent requirements that we have to follow. Being a governmental entity and these quasi-governmental entities, it gives us the ability to do that. But as of right now, there's not any directly on the cusp of following in that.
And then my last question, you talked about you were redesigning your clinics. Is that within the hospital or is that community clinics? I just wanted to know.
Sure. Most of the clinics all of the clinics that Nashville General Hospital operates are inside the hospital. That's where those 40,000 visits take place. Part of the bigger picture discussion is looking outside of that space. But right out of the gate, we feel that we need to do some internal overhaul in terms of flow. And really, it's because volume issues. A lot of the volumes have grown substantially in those clinics, and we're just out of space.
Okay. Thank you so much.
You're welcome.
Thank you, Council Lady. Councilman Maynard.
Thank you, Mr. Chair. Thank you so much, Mr. Boyd. A couple of things under your accomplishments. One of the things when we started, there was a line of credit that had been established. That line of credit has been paid back. I think that is an accomplishment that you all should be proud of in working with the finance department. I mean, you all were able to pay that back, still continue operations, still continue to pay services, and then that helps Metro's finance. I don't want to speak for Mr. Reegling, but doesn't that help us on our bonding? It helps us on all those things. That is a major accomplishment that you guys were able to do so. And with that note, number one is 7.3 million. That's not an insignificant number, but you were able to do it. That's number one. Number two, follow up with Council Lady Moore. Which quasi-government entities has MDHA joined yet?
I'm trying to think. I know we looped in a few of them. I think MDHA is involved now. I know the Airport Authority I don't think is at this point.
MTA is?
Yes.
What about the schools?
Schools, they can access the program.
They
Yes.
can?
Yes.
All
They've
right.
been, since the inception of the program, they've had the ability to access.
And so here's my question is that, you know, you've had some consultants and now Harry has consultants, everybody has consultants, and everybody's talking about efficiencies and being efficient, and that's great. And I think that you guys have done a great job working with your partner and with the finance department and becoming more efficient. But every year I always bring up the issue of revenue and having strategies in place, strategic planning for revenue. And I hope, I'm making a comment, not a question, that we will continue to work with Meharry Medical College as our partner. Doctors drive the engine. They are the engine that drives business at a hospital. So we have to continue to work with Meharry Medical College, Dean Mouton, in order to make sure we have more and more patients, not only inpatient, but even greater outpatient. I understand your census is up over the last 2 months, correct?
Correct.
So how do we continue? We need to continue to have that thing go up so that we're closer to the 100 than we were in the past, but your doctors are the ones that drive that. And so we look forward to working with them and their strategic plan after their consultant gets finished with them so that we can have that happen. Finally, on revenue, I ask this question all the time. What can we do as council, what can we do as council in order to help highlight the Metro Employee Healthcare Incentive Program to get more Metro employees utilizing it, going in there? And then when will you go to the state of Tennessee, and when can we offer this to the state employees? Because if it's working so well with the Metro employees of a tune of $4.6 million, which is nothing to sneeze at, which is almost $2 million net. Imagine if we had access to all the state employees and we got 4% of them or 3% of them or 5% of them to come. So I just have those questions. And if I need to talk to Waverly Crenshaw and have him here all night, which he offered to stay, I could reserve my questions and we could stay all night. I know how to ask questions and talk. But I'd like for you to address that, please.
Sure. I think at some point the opportunity is there to talk to the state. We had some initial discussions with them last year. I think what would have to happen in order to do that is probably a partnership with the three primary safety net hospitals. One, you got the Med in Memphis, if you got Erlanger over in Chattanooga, and us here in Middle Tennessee, and everybody really be on the same page and program requirements. That way it's consistent and can be offered to state employees consistently across the state. So the first step would really have to be from the other hospital facilities to say, one, are they willing to participate in that? And that would be something that I would need to do.
And the other important thing is we have to find a way to promote the Metro Employee Incentive Plan to all of the quasi-governmental entities and to Metro employees. This is your source for your outpatient to increase. And I mean, there's no limit on what we could do, because many people don't know where General Hospital is located, and we get them on the campus and they see what a wonderful facility it is. They'll come back. I mean, we've staff whose wives have had babies at General, including you and some others as well. We utilize General Hospital. So, I would like to see a strategic plan from you all as to how we can help and what you're doing to market it to our Metro employees for them to continue to use it and increase participation in that program. Thank you.
Thank you, Councilmember. Councilmember Langster.
Thank you, Mr. Chair. Mr. Harmon, you've done a great job tonight in handling this committee. Let me compliment you at the top. Mr. Boyd, you know, every year, Nashville General Hospital sits in my district, District 21. And, you know, every year I make the statement on my personal wish list that General becomes a Trauma 2 center. And I still would like to put that out because I know this city is large enough to handle another trauma center. And I am very much in support of that. The facility is there, open, ready, waiting. You ought to see the ambulances that fly past Nashville General headed over to the other hospital for trauma when they could stop right there. I mean, but it's going to happen. Just watch and see. I may not be sitting here. I hope I am, but it's going to happen. Would you explain to me the date of the proposal for Bordeaux long-term care and JB Knowles? What's the deadline date for accepting a proposal for at the end of the month?
Sure. The deadline for potential, people that are responding to the request is the end of this month.
Request to?
Basically, the request that we put out there is for, it's really wide open, so it gives the opportunity for people to give us their interest in whether it's operating, ownership, acquisition, really anything across the board, really to help us find another way to operate that business.
Oh, so the employees do have a right to wonder about job security and longevity there because it is being discussed.
Sure, they do. They do.
I had told them that that's unfortunate. We're going to get out of the long-term care business. Is that what this is about?
Well, I mean, I don't think, again, nothing has been accepted, approved, or decided on, but obviously we are looking at that. That could be one of the options, that we end up not in that business.
But General Hospital is not under this discussion.
Correct.
Thank you. And also 37208, 37209, they are zip codes within my district. Are those two of the highest number of people who access the services of Nashville General?
37208 is number one.
Good.
37209 is number 6.
Okay.
Number 6 on the list.
Who's number 2?
37207.
Okay. All right. Thank you. And you have my continued support, especially for the trauma center.
Thank you.
Thank you, Council Lady. Councilmember Dowell.
Thank you. Maybe next time you'll start at the back of the room. I know you go in order like by districts.
I start with the Budget and Finance Committee members and then
okay.
go to non-members.
Oh, okay. I'm sorry. I didn't know
That's
I was
all right.
second class since I'm not on Budget and Finance. Thank you. Next year I'll make sure I'm on this committee again. I'm just kidding. Thank you, Jason, for being here, and I appreciate the overview that you provided. I just had a quick question on the unique patient count by the top 40 zip codes.
Okay.
I know often we see 37211 and 37013 in the list because we are the 2 largest zip codes in Davidson County. So it's not surprising, the more people you have, the more opportunity there is for people to take a visit to the hospital. But the question that I have, it relates to the total counts you have here. Do these numbers include Metro employees who visit the hospital? Is that included in here, in this patient counts? Are these part Metro employees? The reason why I ask is we have a lot of Metro employees that live out in that southeast area, and a lot of them utilize Metro General. So I was just wondering, is that included in these counts?
It would be, because this is out of our system, so when a patient registers and whatever their address and that zip code is, it would fall into this query.
Okay. I know a lot of the residents out in my district who work for Metro oftentimes share that they patronize Metro General for services, so I was just curious about that. But thank you.
You're welcome.
Councilmember Claiborne.
Thank you, Mr. Chair. Jacoby, I'm one of those second class, and we just have to learn to be patient. Mr. Boyd, thank you for being here. You've been giving this report almost as long as I've been listening to it, and you have certainly brought a more bright and optimistic report than we've had in some of the years past, and I think that's commendable to your leadership and the commission and some of the work that y'all done this past year. In connection with the question that Council Lady Dowell asked, do you have a way to identify the Metro employees that are in that patient count?
We do.
I mean, I've got in 37214, I'm one of the higher Metro employee districts, and it would be interesting to me to see how many of my number there are actually either school employees or police or other Metro office employees.
We can break those out. Basically, what we'll do is pull by their insurance in the system, and then we can find addresses, et cetera, so we can break that out.
Okay. I had a question that Councilman Maynard addressed about involving the state. So I understand your answer that step one in moving forward in that process is to engage with the other two hospitals in the east and in the west. And so you said that would be a step that you would need to take. So could we get a commitment from you to take that step before you come back to us the next time?
Sure. It need to be before that. So, I mean, I think obviously I'll make that commitment to reach out to them and see if they're willing to do that. And if they're not, I still think there's an opportunity to capture the Middle Tennessee.
That was the next question then. If they're not, if either or neither of those are willing to do that, is it within the realm then to look at the Middle Tennessee counties that have state employees and to do that?
Absolutely.
Okay, so we can expect that you're going to move in that direction then?
Yes, sir.
Okay. Any move to have dialogue with any of the major corporations that are located in Nashville about offering care for their employees?
We haven't gone down that path. I know some of the major corporations do have clinics or care clinics inside those facilities. We haven't gotten to that step yet. The one thing that I feel that we need to make sure we're doing, one, we got to get the operations that are happening in our facility right now where the existing volume is and continues to flood in. I think that's where our resources right now are best spent. Now, obviously, we can look at that peripherally as well, but we have so much volume on us right now in the outpatient setting and in the clinics that there's significant opportunity there to get that right, because once that gets right, then you have a lot better ability to offer specialists and your ancillary services to any other outside party that you need to do. So I think we've got a good bit of work internally, because that volume, just our clinic volume internally, has probably grown 10% in the year. And emergency room volume continues to grow because there's not enough access in the clinic. So that's not to say that that's not a next step somewhere in our short-term plan that we need to do. But I think our energy right now has got to be right there on our campus to solve the immediate access issues and needs.
Okay. And one other question. Every year that we've been going through this process, if Ms. Langster hadn't brought it up, somebody else has, about the trauma center. And so that's always floated as an idea, and that there is the potential need for that. Are we any closer to having a serious conversation about a trauma center at Nashville General?
From my perspective, we're not. Getting into the trauma business, it's a big business. It's a costly business. I don't know necessarily whether perceived need or actual need in this community for trauma is. When you get into the trauma business, there's a wealth of services, and even from a medical staff perspective, that is very significant and very costly from where we are today. Not to say that at some point in a long-term growth strategy, if a hospital was growing its services and getting to that point, that it could be feasible, but to go from where we are today to something of that magnitude and what it means, I just don't think that's in our short-term feasible future.
Okay, thank you, and thank you again for a very positive report.
Thank you.
Thank you, Councilman. Councilmember Johnson.
Thank you, Chair Harmon. Executive Board, I just want to commend you and your staff and your board members for the tremendous amount of work that you're doing. I am definitely someone that this council knows is a fan of General Hospital, one that also goes to that hospital to get services done. So your staff at the hospital is first class, and like I said, you do a tremendous amount of work. My question is on your accomplishments. You are doing some great life-saving work around mammograms. I'm a huge fan of your Mammograms in May program and want to see that exposed to a lot more people in Davidson County. And I know that Meharry is getting ready to open up medical offices in the Crossings, formerly Hickory Hollow area in southeast Nashville. And so I wanted to know, in your long-range planning, once they open up those facilities, will those mammograms be offered at those locations proposed in southeast Nashville?
The mammogram, thank you for your kind words. That program is, like I said, continues to grow. As of right now, we do a little over 600 mammograms. It really ends up being mammograms in May, June, and July. Part of the strategy for growing that program, that program really is operated through our foundation, helps get grants for us to be able to do that. Obviously, our partners at Meharry and their radiologists help us perform those as well. Short term, what we really need to look at is, one, upgrading our mammography equipment, and that's part of the plan we need to do. We did some minor upgrades on it this year. We really need to get into digital mammography and then have the ability to really reach out there and do more with it. Ultimately, we'd like to see it, and our foundation board would like to see it a program that we can do throughout the year. Now, obviously, those mammograms have to be done at the site where the machine is, and that's at the hospital. But I do think there's tremendous opportunity to expand the months that we do those in. Right now, it's just really a capacity issue. But as we progress that technology and have some more opportunity, because the need is there. I mean, we could do 1,000 if we had space to do 1,000. And obviously, in the years past, we've gotten shuttle vans from homeless shelters and brought patients. So there's endless opportunities. And as you can see in, some of the outlying zip codes, that's where a lot of the mothers are. That's where a lot of the mothers that are having babies in our facilities are. So it is significant opportunity. Most of the patients that are coming now for that are really pretty local in terms of our North Nashville neighborhood. But there's absolutely a need and the ability to really expand that.
Well, what struck me here was there were 22 undiagnosed breast cancer patients that you basically save their lives by giving them these mammograms.
Right.
And so it's just critically important. This is a large issue with women, and we need more women to be tested early so that they can have an early diagnosis if there is any kind of problem there, and that saves their lives. And so I have received a lot of inquiries from people when I send out the flyers, because my doctor is with the Meharry group. And so I send it out, and many people have asked because of the recent announcement about Meharry coming out to Southeast Davidson. Is there an opportunity to expand that? But you've answered that well. The upgrading of the mammogram equipment, are there enough funds in your budget to be able to upgrade to that, or would you need any additional funding to be able to do that?
Well, I mean, as we look at capital, we look at it in a few different ways. Typically, for a digital mammography machine, you're looking at about $300,000. There's a lot of different ways to acquire that, whether you capitalize it or the operational lease. So I think that there's a way as we go forward into this next year to do that. Obviously, capital dollars are critical as we go forward, and the city's worked with us over the past few years to help ensure that we get the things that we need. And this is one of those that as we go into next year that I think we need.
Thank you for making it a priority.
Thank you.
Council Member Gilmore.
Thank you, Mr. Harmon. Thank you, Jason, for being here. I appreciate it. We have I like Councilor Moore's share. Lancaster share 37208, so we have a high population of people that use your services. I did want to have the change, if I could, between 2011 to 2012, or 2011 to 2012 to 2013, and the increase from the district. I think that's important. And also I wanted to make just maybe two suggestions and just to kind of get some feedback, and it relates to the budget. One is master planning. Normally when we have government projects, we do a lot of master planning like we did, whether it be for the convention center or whether it's something for the, what did you have, Councilor Moore, we did the master plan for? The fairgrounds. And so I'm trying to see why we haven't done that. Most of the time we have a city project and we think about sustainability. Just want to see that. And then I had one more question and I was going to cut it off. So I think that's something that we really need to look into if we're really concerned about sustainability. And then the second one was, we have a hotel motel tax that supports the convention center, and Nashville is the health capital of the country, of the world. So it's interesting to me that we have not assessed a tax on those for-profit hospitals to take care of the uncompensated care that you guys cover that would it does them a favor because they don't have to take on as much. And I think that's something, it's controversial, but they do it in other states. I know in California they have a health care tax. I think that we need to kind of look at some things like that. And so some type of tax on those for-profit hospitals to kind of share in that health care model to take care of some of this uncompensated care that would go back to Metro General. And then the third thing was, I would like to hear more, and I don't know where we could go. We've shifted from this Knowles home to maybe privatizing it or just doing proposals, and there really wasn't any public process, or did I miss that?
It's part of a public process, of a request for proposal process.
Okay, and I would just like to hear how we got there, I guess. So I'm trying to see are you going to have a meeting or just, because constituents are asking us. I didn't know until I read it in the paper, and I know people working at the hospital want to know, is there a way we can get some follow-up to just say, this is how we got from Metro running it as an entity to us looking at other options and doing requests for proposals. I just think as a part of an to inform our constituency, we need something like that.
Okay.
All right?
I think we can put that together, no problem.
All right, then, thank you.
Thank you, Council Member. Council Member Weiner?
Am I last?
You are not last.
No. Wow. Yet again. Well, I will make this quick. First of all, having had an opportunity to sit in on the conversations that Jason has had with Dr. Mouton, my hat is 100% off to both of you for all the hard work and all the hours and hours and hours of collaboration that y'all have done. One thing that I think might be of interest that I've had the opportunity to look at as I've been reading all the reports and all the analyses, I think that it would be important for those folks in the council to see the volume in the different clinics and to see how high that obesity clinic could be, how involved the renal clinics, and really get a sense of the magnitude and the impact that you guys have. And The last thing I'll say is if you haven't had the opportunity to go and see what goes on in that hospital, I strongly recommend that you do it because the work that they're doing over there is of great proportion. Thank you.
Thank you.
Last but not least, Councilman Bedney.
I feel like running around the place just celebrating.
Please don't.
Okay, I won't do it for you. My question has to do with expanded Medicaid. We didn't get that at the state. That would have helped many low-income, hardworking Tennessee and Nashvillians, and the fact that they are not going to be able to take advantage of that, that's also going to impact our budget and the hospital. So the question I have for you is, have you got anybody from the state reach out to you to be able to supplement or replace what we have got through the expanded Medicaid, or did you get anything from the federal government?
Well, you know, you're exactly right. I mean, Medicaid expansion is critically important to the state and to us and what we do. You know, personally, I think that we will see some plan involving Medicaid expansion. I have the pleasure of sitting on the Tennessee Hospital Association board, and you know, we've done a lot of work and working with the governor's office. In order to find a way to make this happen in some way, shape, or form, because it's not just Nashville General Hospital, it's every hospital in the state of Tennessee, I think, is depending on this to happen. So I really am optimistic in our talks that we've had with the governor's office that this will happen. I think you're seeing, you know, other states that are kind of going through the same thing, getting close to an answer and a conclusion. So I really am optimistic that that'll happen. And you're right. I mean, we looked at some of our indigent volumes, and even if just 40% of those indigent patients converted, it's between $7 and $8 million. So that's a significant amount. The other key important thing, not just around the Medicaid expansion, is the population that will be eligible for the insurance exchanges that the federal government is going to set up and run as well. And that could, you know, I think that figures 180 to 220,000 people as well. So we are working, the hospital association's working with hospitals in the state, how we can have resources available on site, because it's ultimately going to be our responsibility to try to get these individuals signed up. You know, just like we do that now to try to get them eligible for Medicaid for the TennCare programs, we're going to have that responsibility to try to give them access and eligibility to sign up for the insurance exchanges once those get going. And if the expansion, you know, whatever shape that takes, we'll have a lot of that responsibility will be on the hospitals as well.
But so far you haven't got anything from the state or the federal government to make up the difference that we have got if we had got the Medicaid expansion. There is no...
No, sir.
Okay, thanks.
Thank you, Councilman. There are no further members in the queue. I'd like to thank you all. Mr. Boyd, for your presentation. Thank you for staying late and on into your evening. We appreciate your time. And thank you so much for your participation. I'd like to thank the council members as well for 3 hours and 40 minutes of good conversation about the budgets we've had before us today. Thank you very much for the opportunity to preside, Mr. Chairman, and I'll be happy to turn this back over to you tomorrow.
I'd like to request
Thank you.
to come back and spend 4 hours with us.
All right. Thank you all.